My name is Bonnie Price, and I'm at Advanced Regenerative Medicine of Idaho in Meridian. And I have come in to have a stem cell regeneration of my knee. My right knee had lost all the cartilage on the inside, and I had a tear on the outside of it. So to be able to get around was really hard to do. It was not bending or standing or holding any at all. And I had heard about stem cells back in the day when they were growing ears on mouses and the new plans for things, and then they got into the tanglement of where is it coming from and who's using it and whatnot. But I had mine in my knee. They went in the side of the knee, it goes into it and fills up the area. Before, I had lots of broken pieces of bone where it was flat and there was no cartilage on the inside of my knee. Right now it's to where you can feel that there's about 1 inch or so of padding between the knee, and the outside part where it was torn is beginning to fill in pretty good. I have no pain in it at all. Once in a while it'll tell me if I'm doing something I really shouldn't be doing. Well, I'm kind of a homebody before, but I would like to be able to walk around now. I'm able to go out and walk where I couldn't before. I could only go a little ways, and it just got to be a pain. Just to be able to get around, and like over for Thanksgiving, I walked across the yard, which I was afraid to do before. I would hold on to everything, and with my partner, I hold on to his arm just to go places because it was just hard to do. But yeah, just being able to get up and go and do stuff and without it hurting is a main thing right there. I'm really impressed by how much it's a lot better. It's nice to have no surgery for it, because it's like, I'm with the military, the VA says, well, a couple of years before they can get you in, and you, like everybody was doing, you know, my mom had knee surgery, you have a few months to rehab to get your muscles and stuff all back together again after they tear it apart. This is so much simpler, and it really does regenerate it, where the surgery doesn't really do it, just replace it. I've heard of people that their replacements are breaking and splintering, so they're trying to be cheap on how they do things with the metal on it, and it's just not happening. But this repairs your body. It regrows the cartilage and it regrows the bone. I've felt a lot of it, where it's not pointy over at the front of it like it was when it was flat with just no bone, or flat bone, no cartilage. And it's got a lot more flexibility to it. So yeah, it definitely is a big difference between what you may have to go through with surgery. Then this is helpful quite a bit. I recommend it to anybody. I'm really pleased to have my knee fixed. It's not gonna be falling apart like it did. So yeah, I thank you very much. It was well worth it, and that's it.